Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, I was very surprised the other day, you're looking at my hand when I'm waving it. I was very surprised the other day, someone had mentioned that we've never really done one on treating the neck. And I think we've done some like for a stiff neck, but I don't think we've ever really done one on treating the neck.
Right, so yeah, what do we got
Top
here?
3 exercises to stop neck pain.
Sure.
All right, and this is what you want to keep in mind. First off, if you're having neck pain for the first time, we will probably suggest that you want to go see a doctor. If this is the first time you've ever had it, could be a lot of other things. But if it's something that's recurrent or you're always having neck pain, this is a good one for you to try.
Sure.
All right, and this is neck and arm pain, by the way, not just neck pain, especially if the arm pain seems to be coming from the neck.
Right.
And when we're selecting these exercises, because we're kind of trying to make a choice of which exercise to use, you're going to do it based upon this one issue. You really need to understand this. Let's say, for example, that here's a person and we're viewing him from the back.
Right.
And this is the area of pain that we're looking at. This patient has very severe pain. It goes all the way from the neck, into the shoulder blade, down the arm, all the way into the hand. So when we start doing exercises, what we want to see is that the pain starts leaving the hand and the arm. You know, if it even goes up that much, that's a great improvement.
Right.
All right, eventually what you want to see is that it actually, what we call centralizes. It all starts to focus right in the neck itself. Sometimes it can even get a little more intense there.
Right.
Brad, but most people seem to know, Brad, when it's like, yeah, it's taking away the pain.
Yeah, it'll happen
Right.
pretty quickly. On the other hand, if the pain from the exercise gets better up in here, but worse down in here in the hand, that's opposite.
Yeah, that's the opposite. You stop, and then you just can't do this. You need to see a therapist or something. So you're right, Brad. If let's say you start and your pain is in this area here, and then you do the exercise and it starts going down here, that's an absolute contraindication.
Big red flag.
Big red flag. Yeah. Now your pain might be, you might also be having pain over here
Yeah.
and here to start off with. And it would be the same with that. When you do the exercises, you want to see that it starts leaving the upper, there we go, upper shoulders and goes into the neck. I'm sorry to spend so much time on this, but you really need to understand this while we're doing these exercises.
And you might wonder, why does the pain go down the arm? I'm not getting into the detail, but the nerves actually go from the neck and go down into the arm, and it follows the nerve track, etc.
So, all right,
Okay.
now we know what we have to do. We have to get that pain getting out of the arm, getting out of the shoulder blade. So this is what we start with. We're going to start off with chin tucks, Brad. This is the one everybody starts with. You're going to be doing this one. I just realized we are going to have to lay down at some point.
Oh yeah.
So chin tucks, Brad and I will be both doing it. You want to have good posture in a chair.
Up tall,
Not tall, yeah, not slouched. And you're actually going to tuck your chin back.
Yeah.
Now, Brad, what's the thing you always say? You always say, don't be going down like
Right,
this.
don't look down, pretend like someone's taking a pie and they're gonna put it in your face, you're just gonna back your face up.
Yeah,
Or like there's a shelf here and you slide your chin on that shelf.
yeah,
If you want, you can do a little overpressure like this, but that's not necessary.
yeah. And people do it different ways. Some people hook it like this and give a little overpressure. But you can go ahead and do pressure on, pressure off, pressure on, pressure off, 10 times. And you're gonna do this actually almost every hour or 6 to 8 times a day. That's crazy, but that's,
And when you do it, you should get some centralization, the pain coming out of the arm and going up towards the
at
shoulder.
the very
and the
least,
neck.
it shouldn't get worse with this one.
Right.
Right, yeah, if you do this, it might hurt at first,
Mhm.
Brad, but within, 3, 4, 5 reps, it should either just maintain the same, or it should get or it should get better,
Right.
yeah.
On
So-
the other hand, if it 5 and 6 is getting worse and worse, then you stop.
Then you stop, yep. Now, along with this one, you always wanna do the extension then too. So you're gonna start the extension by first doing a few of these, a few of the chin tucks,
Yep.
and then you're gonna go back like this and lean back. Now, while you're back here, and again, you're gonna wanna start feeling that, after doing a bunch of repetitions, that some of the pain is getting better. While you're back here, you're actually gonna turn your nose 1 inch to the left, 1 inch to the right, and while you're turning it back, you're trying to go back further, and further, and further.
Right.
Okay, Brad, you wanna show it too?
Right, and again, remember, when you do this, and I've experienced it myself and with many patients, if they're doing this and they say, oh, it hurts right back in here, then I'll ask them, how does the arm feel? And the arm feels better.
Right.
Then you can continue to do it. And back.
And further, the further you can go, and you can see, we actually like these solid back chairs that kind of hit you mid-shoulder blade.
Right.
Because you can lean up back over them and even go back
Right.
further.
Now, what I do, and I think Bob does this too, we were talking about this, this is kind of working, so we go to full extension, but it hurts and they can't quite do it.
Right.
And then we go to some support with a towel roll.
Exactly.
And I think you and I have different ways to roll up the towel, but
Yeah.
it's not that important. And then I'll have them do this and say, oh yeah, that feels better, it's more controllable, it feels better. And then after they do the full extension with some support here, then you can start to do it without.
Exactly.
So it's a progression.
Let's take the worst case scenario,
Okay.
right? Let's say you start doing these, it actually maybe makes it even a little worse.
Yeah.
And then you do these, it makes it a little worse. Then you're gonna actually start on the mat. And you're gonna lay down, got me, Lonnie?
Yep.
And you're gonna do your chin tucks this way. And it's the same thing. Now this is, we've taken all the weight off the head and the neck, so it really should not cause increased pain. If you get numbness or tingling down your arm or pain, then you definitely have to see the doctor, and this is just not working. But otherwise, you start with this now, and then you go to the one with the towel.
Right.
If you're having a lot of pain.
Right.
So this would be the option of, in case you're having too much pain to even do it the other way the first time.
Right.
So it's the same exercise, chin tucks, but you're on the mat. Sometimes I have maybe even a little towel here, Brad.
Yeah.
A
This
little
is,
roll towel.
and I'll give verbal cues. Why don't you put your head down? And I'll say, I'll put my fingers here, and I'll say to the patient, can you try and touch your neck against my fingers? And so now I can feel and pinch my fingers there.
Yeah, I'm not trying to bring my chin down like this. I'm just trying to bring it back.
Yeah, it's a strange motion. It takes a little bit to get coordinated to do it if you haven't thought about it or done it before.
So with some people, actually 80% of the people, they get relief from one of these exercises. We still have one more to do.
Right.
But generally, a lot of times, by doing the chin tucks and going to this, and eventually when they get way, way, way back, and they're turning their neck like this, they get way, way back, eventually, a lot of times the pain goes away.
Right.
But there are some where it just kind of seems to stall, and this was me, so I experienced this myself, and I was having pain down my right arm, not that far, but down here, and what I had to do then is what we call right side bending. So if the pain's on this side, you're gonna go ahead and do your chin tuck, and then you're gonna bend your ear to the right shoulder. Chin tuck, ear to the right shoulder. Chin tuck, ear to the right shoulder.
Right.
Any comments, Brad?
Well,
Don't bring
again,
the shoulder up.
right. And again, it's the same thing. After you do the first couple three, the symptoms of pain should start coming down or centralizing. If it doesn't, you need to get some help.
And this, I found, and I probably overdid, I did a lot of these the first day, and I got sore, I really got sore up in the neck, but it did take this away. The next day, I'm like, it was gone. So it worked great. I just had, one of my last patients I've had that I used this with, he was a dentist, and we also had to go to these. And it just took it away. He was
Sure.
real right-handed, and,
Yeah.
it was affecting his practice. He wasn't even gonna be able to work anymore, so
Right.
it worked really great. If the pain's going down the left arm, same thing, chin tuck, bend to the left. Chin tuck, bend to the
Sure,
left.
You bet.
So those are the three exercises. It's chin tucks, extensions, and side bend. You might not have to do the side bend if the other two take it away.
Right, you bet.
So, again, we've had great luck with this. It's the McKenzie method. I'll put their website again on down below, so in case people want to look into it further.
Right, it's a very popular treatment throughout the world, and it promotes self-treatment, and you should always have improvement from the exercise. If you don't, you stop.
Right.
All right.
Good luck to you.